Hello, and welcome to today's NITC webinar, Rethinking Ecological Momentary Assessment Data Collection Strategies for Transportation Research, Leveraging App-Based Technologies. My name is Lisa Patterson, and I will be your moderator for today. I am the Tech Transfer and Workforce Development Program Manager for TREC, the Transportation Research and Education Center at Portland State University. TREC houses NITC, the National Institute for Transportation and Communities. NITC is the federally designated National University Transportation Center for Livable Communities and is a Portland State-led partnership with University of Oregon, Oregon Institute of Technology, University of Utah, University of Arizona, and University of Texas, Arlington. Our webinars are based on original research conducted by faculty, researchers, and students at NITC partner universities. The goal of these webinars is to get useful research results into the hands of practitioners, academics, and other stakeholders. Today's webinar will be led by three researchers from the University of Texas at Arlington: Noelle Fields, Courtney Cronley, and Stephen Mattingly from the University of Texas at Arlington. Dr. Fields is an assistant professor at the University of Texas at Arlington School of Social Work. Her primary research interests are in gerontology, with a particular focus on family caregiving and dementia, home and community-based services for older adults, and technology and aging. Dr. Fields is a licensed clinical social worker and has practice experience working with both families and elders in a variety of settings. Dr. Fields has co-authored several publications related to assisted living, adult day services, aging well, and dementia caregiving. She also has presented at numerous national conferences on her research in gerontology and social work. Dr. Fields teaches courses such as family caregiving and aging, direct practice with aging, and human behavior in the social environment. Dr. Cronley's research focuses on the context of care for women and children experiencing homelessness. She has published over 20 manuscripts and presented at premier national conferences in social work and public health. Currently, she is completing 2 grant-funded mixed method studies. One examines the intersection of the homeless and child welfare service and sectors among mothers experiencing homelessness, and the second explores housing insecurity as an antecedent and correlate of engaging in sex work among high-risk women. She also teaches advanced research methods for social work master's students and intermediate statistics for doctoral students. Dr. Mattingly joined the University of Texas at Arlington in September 2002. Prior to joining UTA, he served on the faculty at the University of Alaska Fairbanks for 2.5 years and also served as a lecturer at the University of Southern California. He teaches undergraduate courses in transportation engineering and transportation planning, as well as graduate courses in analytical method models in transportation, system evaluation and decision-making, transportation network analysis, transportation planning, and bicycle and pedestrian facility planning and design. Dr. Mattingly's areas of research include a wide variety of projects. State-funded research projects include work on evaluating existing highway right-of-way for accommodating high-speed passenger rail, evaluating overheight detection devices, managed lane pricing and weaving, institutional approaches for interjurisdictional system management, and detection and mitigation of roadway hazards for bicyclists. His federally funded projects include developing public health performance measures for transportation infrastructure, engineering sustainable engineers, evaluation of the Anaheim Advanced Traffic Control System for field operational tests, SCOOT performance and assessment of institutional issues, documenting the institutional issues associated with the Irvine Integrated Corridor freeway ramp metering, and arterial adaptive control field operation tests, impacts of the Northridge earthquake on traffic network performance, and determining the safety impact on and around taxiway. So, all right. So before I hand it over to our speakers, I'll give you a brief overview of the webinar. Noelle, Courtney, and Stephen will present for about 40 minutes. During this time, you can submit questions, which will be answered at the end of the webinar. We also will be recording today's webinar and we'll make it available on our website. And you should receive the video recording and presentation slides in an email following the webinar in the next day or two. If you are tracking professional development hours, this webinar is eligible for 1 hour of continuing education credit. Instructions on how to redeem the credit will also be included in your webinar email. And lastly, we have 2 upcoming webinars scheduled on March 7th. How Hagedorn, the Interim Director of TREC and IBPI at Portland State University, will present on the Bike Ped Portal, a national bicycle and pedestrian count archive. And on April 26th, Danya Rumor from the University of Utah will present on tools and techniques for teaching collaborative regional planning, enhancing livable and sustainable transportations in gateway and natural amenity regions. All right, and lastly, during the presentation, here's where you can submit your questions for our presenters by using the question pane on your control panel. We will track the questions and the presenters will respond to them at the end of the webinar. If we run out of time, we'll send out written responses for any questions left unanswered. And with that, I will hand it over to Noelle to present their research.
Yes, hi everyone. Just want to make sure you can see my screen. Looks like you can. Great. Well, we are really excited to talk about our work and want to first acknowledge that this particular project that we'll be discussing today was funded by the Transportation Center for Livable Communities at Western Michigan. We are very pleased, though, that we are our team at UTA are now partners with NITC, and so we will be engaging in several other projects that have just started and are looking forward to talking more about those, hopefully in the future, in future webinars. So just as a brief overview, want to talk a little bit about what we'll be discussing today in the webinar. Want to talk briefly about our interdisciplinary team approach. We're going to talk about environmental justice populations and social exclusion, gaps in the current research, the context of our study, the research objectives, and we're going to then talk more in detail about our app called MyAmble and its features, and then discuss lessons learned from our beta test as well as overall from the project. So just wanted to begin by talking a little bit about our interdisciplinary team approach. Certainly you could hear from our bios that Courtney, Steve, and I all come from different backgrounds, although Courtney and I are both in the School of Social Work. We are researchers in different areas. She works mostly poverty and women experiencing homelessness, while my focus is primarily on gerontology. And of course, Steve is in the Department of Civil Engineering. So we make quite a team, each bringing a different perspective in terms of the populations that we serve and also the methods with which we conduct our research. But it's been a really enriching experience. And so I'll just put in a plug that hopefully maybe this type of collaboration can be developed at other universities and other communities where you can have social work and civil engineering work together to develop innovative ideas and solutions for complex social problems such as transportation disadvantage. So even though increasing attention is being paid to the importance of working across disciplines in higher education, you don't typically see social work collaborations with engineering and technology. So we feel very fortunate that we have started this partnership and have been engaging in so many exciting projects together. This project has been funded by the U.S. Department of Transportation and includes members from the School of Social Work as well as our PhD students and master students in social work. And then, of course, we also have from civil engineering. We've had a PhD student in civil engineering and also a master student computer science. So we have faculty from across the departments as well as students from across the departments. We have really found that this unique composition of having social science and engineering team members allows for a more holistic perspective and comprehensive approach to problem solving so that we can better integrate theories of human behavior and the human experience into transportation planning. Our study is focused on two EJ or environmental justice population, one being transportation disadvantaged older adults and the other single mothers experiencing homelessness. Both of these populations are at increased risk for disability as well as health problems, may experience lower income, and have limited social connection. The rationale for focusing on these two populations is really that the U.S. is facing rising demographic shifts, such as growing minority and aging populations, as well as increasing disparities in wealth and socioeconomic status. So these factors lead to concerns about how U.S. transportation systems are responding to the needs of these populations. Research shows that minority groups, individuals who are lower income, and older adults are all at high risk of experiencing transportation disadvantage, perhaps due to where they live or to the fact that they are less likely to travel during peak work commuting hours. Dr. Cronley and I have each worked separately with these two EJ populations. We'll talk a little bit about our previous work that we sort of bring together, knowledge from past research, and how we are using that to inform our current study. So I'm going to talk a little bit about the demographics of the United States in terms of older adults. They are expected to considerably change in the coming decades as our country is going to be experiencing significant growth in the aging population. Just a few statistics to give some context for why this is so important in terms of older adults. In 2050, the population of those ages 65 and older is projected to be 83.7 million, which is almost double what it was in 2012. Approximately 10,000 Americans are expected to turn 65 years old every day, constituting 20% of the total population by the year 2030. Now, what we know is that the vast majority of older adults wish to age in place, so they would rather, of course, live in their own homes or stay with family members in the community rather than live in institutional care settings such as nursing homes. This, of course, is driven by their preferences as well as the preferences of their family members to have their loved ones remain at home in the community, as well as the high cost of nursing home care. However, to successfully age in place, older adults need to be able to access the support services and amenities that they are going to require as they grow older, such as making trips to the grocery store, the doctor's office, going to church, to friends' homes. And what we find is such trips are typically taken by car. However, because people live an average of 7 to 10 years beyond their ability to drive safely, many older adults are going to need alternative transportation choices to maintain their independence in the community. Too often, however, the existing built environment and transportation infrastructure lacks safe, viable, accessible, and affordable options for these older adults. In my own work at UT Arlington, we conducted a study of aging well in Arlington, and what we found from the older adults that participated in focus groups and individual interviews is that transportation is among one of the highest concerns that they have in terms of their desire and hope to be able to age in place in Arlington. So I have a quote here from one of our participants in that Aging Well study that is talking about being not having a car and having to rely on his power chair to get around town. So he says, my power chair got stuck in the mud over by the restaurant, over there by that tire shop. I couldn't go forwards, backwards. And the police officer came out and helped me stand so that the guy from the tire company could come and push up my chair. You can go this side of Collins and you can get through, but if you're on the other side of Collins, which is a street, where the restaurants and all the other places are, you can't go straight down the thing. They've got dips and holes. It's bad enough trying to cross at a crosswalk, let alone be in the road when they're, meaning cars or trucks, are coming at you. So you can see in terms of the area in which we're conducting our work in Arlington, older adults are trying, many of them are trying to get out and about by whatever means possible, and oftentimes this can be at great risk to their health and safety. In this next slide, I'm going to let Dr. Cronley talk more about her work with mothers experiencing homelessness in Fort Worth.
Okay, hi everyone, this is Courtney, and I'm going to shift gears a little bit and talk about individuals at sort of the other end of the life span, and that's women with dependent children who are living in precarious housing situations. So, like with the aging population in the United States, we've seen sort of a growing social phenomenon around family homelessness. So in 2010, former President Barack Obama issued a federal initiative to end homelessness prevent and end homelessness in the next 10 years by 2020. And the nation made a lot of strides regarding chronic homelessness, which is mostly a condition experienced by single men, as well as with veterans. But family homelessness has seen only minimal declines. And in fact, in some states, we've actually seen an increase in this. And it's not entirely clear what's going on, but it probably is related to the economic conditions in our country, we've seen great increases in wealth amongst individuals who already were fairly economically advantaged, while we've seen people who were not economically advantaged during the first half of the 2000s have tended to actually see declines in their real wealth. And so this may be playing into the rising number of women and dependent children experiencing homelessness. In fact, women actually make up 40% of all of individuals experiencing homelessness, which is probably a surprising number to a lot of people. They think of homelessness as being primarily a male issue. But this may be due to the fact that women are overrepresented in family homelessness, and the vast majority of families who are homeless are actually headed by single mothers. And so probably the underlying mechanism forcing women into precarious housing situations with their children is economic instability. And what we found is that transportation is sort of a critical link to women gaining economic independence and moving from living in subsidized housing and relying on federal welfare benefits to actually being able to secure employment and maintain employment. So there hasn't actually been a lot of research exploring this empirically. Instead, what we have found is that practitioners consistently report that women who are trying to get jobs point to transportation and lack of transportation as a primary barrier to them going on job interviews, being able to transport their children safely to school, to childcare centers. One of the issues that we have often found in our area is that our bus system, we actually don't have one in Arlington, Texas, but we have one in the Dallas Metroplex. That's all based on a spoke and wheel system, which basically means that if you need to go anywhere in the city, you have to go from your bus stop to the center of the city and then back out to the other areas of the city. So it's an extraordinarily inconvenient way to get around town. It requires 2 hours, multiple bus stops, lots of waiting, bus stops that don't have shade or don't have cover from inclement weather. And those are not really feasible ways for a woman with a stroller and a diaper bag and another toddler to really get around in a convenient way. And like with Noelle, we had done some preliminary focus groups with women who were experiencing homelessness in the Dallas-Fort Worth region. And sure enough, what they consistently told us was that transportation was a critical problem for them. And I have a quote here from one woman who says, I mean to get somewhere on time and to even get places from back and forth, like appointments. You got to be at an appointment and say you missed the bus by a couple of seconds, you have to wait a whole nother hour. Or you get on a bus and it breaks down or something happens and you lose a lot of different opportunities at different times. So you can see that in the Dallas-Fort Worth region, for women who are experiencing homelessness and relying on public transportation, it's really not a reliable and feasible way for them to get around town and to be professional and to make appointments. But even more interestingly, in between the Dallas and Fort Worth region, the city of Arlington, where we do a lot of our work, actually doesn't even have any public bus systems. It has one very, very small one, which it only recently put in place. So there isn't even an inconvenient bus for women to rely on. And so I've often heard from women reporting in the last 2 or 3 years that they're using Uber to get to jobs. So they're spending a lot of the income that they're actually making through their jobs just trying to get there and to get home. So as you can see, kind of from a different angle for women with dependent children, the issue of transportation becomes a critical economic barrier to them gaining economic independence and housing stability. So one of the things, I'm going to shift now to the theoretical paradigm that we've been using in our work with transportation in disadvantaged populations. And it's an idea that's come out of the UK called social exclusion. And with both the older adults and the women, what we tended to hear was that the lack of transportation or adequate transportation was leading them to feel marginalized and cut off from normal activities that many of us take for granted. For instance, going to a doctor's appointment and knowing that we can get there on time, or taking our children to childcare, or going to work. How many of you, drove today to get to work, and it was just sort of commonplace that you get in your car, you turn it on, you drive 20 minutes, and you get in and you park and you walk out of your car. For many of these individuals, they're having to go through multiple planning steps ahead of time just to get anywhere. And it means that they're really not able to take part in a lot of the day-to-day activities that we experience. And so when we started thinking about this, we came across this concept of social exclusion, which is theorized as essentially a process by which individuals or households experience deprivation, either through lack of resources like income or social links to the wider community of society. And we feel like this really encapsulates why transportation disadvantage is such a problem for vulnerable environmental justice populations in the United States, because it's really playing into this process of exclusion and deprivation for certain individuals in a systematic way. And essentially, this marginalization of individuals is leading to them to be cut off from opportunities such that they could integrate into the larger community. And it's not just economic opportunities, but we also have to think about quality of life and socialization. So individuals experiencing social exclusion might live shorter lives because they're not able to access healthcare, or they might live lonelier lives because they're not able to connect with others and to engage in social processes, which are really critical to people's lives, maybe not economically, but to what it means to be a human. And so it's kind of, in some ways, enormously striking how transportation can come to bear on so many of these additional aspects of people's lives, either to increase their social inclusion or to further increase their social exclusion. And so what we're hoping to do in our research is to somehow document some of this social exclusion and devise ways to overcome transportation barriers and reduce social exclusion. So the domains of social exclusion, as you can see on the PowerPoint here, really fall across three primary areas: resources, participation, and quality of life. So resources are the basic ideas you think of in terms of food, shelter, clothing, access to public and private services like healthcare, and access to social resources such as food stamps or WIC, etc. Participation is really when we get into that social engagement, so your ability to socialize with others, your ability to engage in cultural and education activities, so going to school, going to museums, and also think about political and civic participation. A lot of individuals with transportation barriers can't vote, they can't run for public office, so their voices continue to be underrepresented in the political and the policy sphere of the United States. And that last domain is quality of life. So again, your ability to live a satisfying life, to feel healthy, to feel confident, to feel at peace and content with your life, something that I think most of us take for granted or aspire to. Transportation can really lead to reduction in opportunities that directly links to declines in health and well-being, as well as crime, harm, and criminalization. Increasingly, individuals who lack access to transportation also live in neighborhoods that are less safe, that are more socially disorganized. So there are less neighbors that you know, more broken windows, more crime, etc. Again, what we're doing is hoping to utilize this paradigm of social exclusion to document how individuals who are not considered or not factored into policy making around or transportation policy making are actually leading to lost opportunities for these individuals, that is then having a social, economic, and physical and mental health impact on their lives and on our society as a whole. And so one of the ways that traditionally transportation planners and researchers have looked to document transportation activities is through ecological momentary assessment, or EMA. And this idea is really, this methodology was really developed to overcome common data collection problems when you ask people about their behaviors. So when you ask people, like, how often did you drive last week, you may get inaccurate data because they don't really remember. Oh, I think I drove, I don't know, 5 times. If you ask people also about how much they drove, you can create testing bias. So they're being asked out of a natural environment how much they drove and where they drove, and they don't really remember. So EMA was developed to overcome those 2 biases. It involves repeated sampling, which means you go back to people again and again and again, and you ask them in the real time. So you ask them, you might call them right in the middle of the day and say, hey, are you driving anywhere right now? And you ask them again in their natural environments. And hopefully through those 3 components, you would overcome the recall and the testing bias. And EMA actually started not in transportation, or may have concurrently, but where it's been used most frequently with the populations that we're looking at is actually with substance use literature and research. So asking people questions about how often they drank in the past week, or how often that they smoked tobacco, for instance. And here's just an example of how this data collection might look. At this moment, where are you? At this moment, are you experiencing any trouble? At this moment, how anxious are you feeling? So you're asking people these questions repeatedly in their natural environment in the real time. And so our idea was to take this EMA data collection method and bring it to bear on transportation disadvantage. So traditionally, transportation planners and civil engineers have used EMA methods in the form of travel diaries, but they tend to focus on populations of people whom we know travel. Employed, middle class, middle-aged individuals who are going to work during peak commuter times. What they don't do with EMA is try to factor in or to document in real time the travel planning needs of those who are not actually traveling. So basically, those who are not traveling due to transportation disadvantage, where do you want to go right now? And so now I'm going to hand it over to Steve, who is our civil engineer, and he's going to talk a little bit about this data paradox and what we've been doing with trying to resolve it.
Good morning. So the paradox that we're facing here really focuses on the fact that if people don't travel, then we don't include you in the planning process. So there's no ability to address gaps in our transportation system that may exist. We want to be able to look at the challenges that these populations are facing, so that they're able to respond to the future challenges and close these gaps by including that in our planning process. Until we can accomplish that, then we're failing to include a significant portion of the population that needs transportation service. So my section was rather limited there. I'm going to go ahead and move on to Noelle again.
Sorry about that. So just want to talk a little bit about the summary of the research gaps. So we've highlighted a few of these points, but basically there really are no existing data collection strategies to record and investigate both the actual and desired travel experiences of EJ populations. So we are trying to look at this more closely through our work. Also, existing research really fails to measure the holistic impact of transportation gaps on the lived experiences of EJ populations. So we, in our study, are trying to kind of incorporate a qualitative component to be able to capture that lived experience. And again, we lack empirical data collection methods that focus on transportation equity and transportation planning. which we really need in order to promote livable communities regardless of age, across the lifespan. So that is what we are attempting to do to help address some of these research gaps. I'll talk a little bit about the study context. As Courtney mentioned, we are looking at Fort Worth and Arlington, where UT Arlington is located, excuse me, in Tarrant County. The study is taking place in two cities, Fort Worth and Arlington. Tarrant County is actually the third largest county in Texas and borders Dallas County, which is in north central Texas. It is one of the fastest growing communities in the United States, and Tarrant County's population is projected to grow to more than 2 million by 2020. Fort Worth is the largest city in Tarrant County, and Arlington is the second largest city. And as Courtney mentioned earlier, Arlington is actually the largest municipality in the U.S. that lacks a public transit system. So this is, of course, of significant concern to these EJ populations. This actually shows an arterial in Arlington. And as you can see, this actually was a photo taken during our Aging Well in Arlington study. And so as you can imagine, if you were an older adult with limited mobility and/or a mother who is maybe pushing a stroller and has a toddler in tow, it would be quite difficult to navigate around due to transportation disadvantage. So we just wanted to kind of give an illustration of some of the actual environmental challenges that many of our folks are facing. In terms of our research objectives, we are utilizing an EMA design to collect data from lower income transportation disadvantaged older adults, as well as mothers experiencing homelessness. Our goal is to really identify suppressed travel and activities and to measure the frequency, magnitude, and impact. We're also looking to measure overall attitudes and impacts of transportation disadvantage. The other important piece of our study is sort of getting at that innovation, is to be able to just test the feasibility of using an electronic tablet with an app designed as a digital platform to collect this type of data. So this is a very novel way to actually approach getting at transportation disadvantage and measuring it in this EMA, using an EMA design. So we designed an app as a team. We've named it MyAmble. And it is designed to prompt our populations to identify and characterize their transportation plans and desires through the app. So using the app, they actually plan and review their transportation plans for the day. They make changes to the necessary changes to their actual trips, and they can record the reasons behind any changes in their plans, which we'll talk about more in detail. They may also record their digital diary entries by typing in the app, or they can use a voice recorder, which automatically transcribes their voice to text. Additionally, participants are encouraged to take pictures and/or video using the app in order to capture visual data related to their perceptions of transportation mobility. It's our hope that this is going to improve data quality using MyAmble. We are comparing it to a pen and paper version, so we'll be able to look at the quality of the data using the app versus using pen and paper. And our app also does consider all travel modes and activities, as we'll talk more about in the coming slide. So there are 4 features of MyAmble. There's a daily trip planner, a travel history, a travel buddy, which is the more interactive text messaging feature, and a challenge logger, which we will be talking about. So in our next slide, Steve is going to share a little bit about how MyAmble is different from other transportation data collection strategies.
Okay, so primarily the big difference that we're looking at in MyAmble is that we are now addressing unserved and failed trips. So in a typical diary, we just collect data on those observed trips. Now we're looking at someone making a plan for the trips that they'd like to engage in during the day, identifying which trips were not able to be included in that plan, even if they wanted to participate in an activity, and identifying the reasons for that, the impact of that on them, the trip importance, and the consequences to their lives associated with it. The same thing applies for a trip that they planned to take, but they ran out of time, the bus broke down, they couldn't get the ride that they expected to show up, and really try to document the gaps and the consequences of those gaps on the populations that we're studying. We feature many of the same components that you'd find in just a typical smartphone travel diary app. The one big difference that ours does not do right now is we don't use GPS to identify the specific trips. That's the one limitation that we have opted to not try to include right now for IRB purposes. However, we're including these other components associated with social exclusion and trip challenges and the overall impact on the individual. Thank you.
So I will talk a little bit about the daily trip planner in the morning, and we have some screenshots here so that you're able to get an idea of what MyAmble looks like on the tablet. So they are able to choose from 4 options, including the daily trip planner, which we'll talk about. So you can imagine if you clicked daily trip planner, it would first ask, did you complete any emergency or unplanned trips since your last login? So that way folks are allowed to actually document if they had any of those types of travel activities. And then it's going to ask them if they had a plan for the day. So let's just imagine for a moment that part of a person's plan for the day is to go to the grocery store. So as you can see here, they actually can select from a many options. So they can choose more than one, but what we'll do is, for purposes of this presentation, we'll just choose grocery store and walk through what that would be like. So we'll say they're choosing grocery store and they're going to make the plan related to that grocery store trip. So it's going to ask them what is their destination for the trip. So they could either type in or use the voice recognition to say, you know, the particular grocery store they're going to. They're also going to rank how important that trip is for them using a Likert scale slider, and how they will get to their destination. So are they going to be using something like paratransit? Are they planning on using a train or taxi? We include all these different modes. Then we also ask them if they're going to need any assistance. For instance, if it's an older adult, are they going to be using a wheelchair? I'm sorry, not assistance, but will they be using a wheelchair to get to that primary source of transportation? Will they need any assistance as well from another person? We have them indicate that in question 4, whether they're going to have a family member help them in and out of the car or transferring in and out of the wheelchair. We ask them their approximate departure time and if they're planning on going to any other grocery store today as well. So the idea is they can go back to that original menu and choose other icons to plan their day. So in addition to the grocery store, if they're going to the pharmacy, doctor's office, whatnot, they can select those icons and they would essentially go through the same process for each planned trip. We also asked them at the end, kind of their planning process, were there any activities that they would like to complete but can't? And we want them to tell us what are the activities and why are they not including them. So these are open-ended questions. We found in our beta, most folks liked talking into the tablet and having it transcribed for them. So this is our attempt at capturing sort of that suppressed travel in this way. And so at the end of their plan, it reminds them to please review their trips later in the day. So they go about their day, and in the evening time, when they go back into the trip planner, it asks them the trip details for each trip that they planned. So it's going to ask them, for instance, in the grocery store, you know, what were the details? Did you actually go to, for instance, we said Tom Thumb grocery store? What mode of transportation did they use? How did they get there? Did they need assistance from another person? And then what we also ask them is, again, trying to capture some more of the psychosocial impacts of transportation. Did the trip enable them to spend time with their family or friends? They can select the button yes or no, the little radio button. On a scale of 1 to 5, to what extent did completing the trip improve their mood? How important was this trip to them? Did they face any problems? And then asking them what problems that they faced. We also asked them overall, to what extent was this trip successful? Another component of the evening review journal is we asked them kind of more global questions. To what extent did you complete the trips that you planned for today, and what were the benefits of completing the trips? We also asked them again about, after making their plan, is there anything they thought of that they wanted to complete but that wasn't possible today, and asked them why it was not able to be completed. On the next slide, Courtney will be discussing the travel history feature of MyAmble.
Hello, everyone. I'm back, and one of the things that we thought would be really interesting would be to use the app to collect more rich data, including antecedents to travel and transportation disadvantage. And we thought we would capture this through what we called the travel history component of the app. So throughout the time that our participants are using it, we're going to have a set of questions in the app that we'll invite them to respond to in a random way, but such that we make sure that everyone answers all of the questions. But they won't necessarily sit down and complete a survey at one time. They might get a question one night and another question the following night. But you can see that the questions in the travel history car history and driving cessation, which will be particularly important, we think, for the older adults. Sort of what were the antecedents that led to them choosing not to drive anymore, or being forced not to drive, or being recommended that they don't drive. Childhood, their favorite car, how they learned to drive, favorite road trips, things of that sort. We think that those stories about transportation are deeply tied into the individual psyche of people in the United States, and we don't know yet how, but we suspect that this will be informative related to sort of disparities in transportation and transportation disadvantage. And then finally, we'll be asking them some questions about their history with public transit. How long have they used it? How frequently? Why have they used it? Why do they no longer use it if they no longer use it? So again, we're really capturing a lot of rich data around transportation, not just where they're going and where they're not going. And so here are just some sample questions. Did you grow up using public transportation? Which, you know, is going to be, if you grew up in New York City and you use the subway all the time and the buses, it's not too daunting to use public transportation. But if you grew up in the suburbs and then suddenly you're faced with using it, either with 3 kids and you're a single mom, or as an older adult, it might be pretty daunting. First time you used it, and earliest memories of your first car. So some other examples of travel history. How old were you when you used your first car? When you got your first car, you know, it might be interesting to find out there are generational differences. So we know that the millennial generation is increasingly expressing desire not to drive, whereas I grew up in the 80s and 90s and I couldn't wait till I turned 15 and got my learner's permit, right? But those early experiences are going to influence people's transportation decisions in the future. And we'd like to know how, for our participants, those early experiences differentially led to people's transportation behaviors now as adults and older adults. Okay, so now I'm going to transfer it over to Steve, and he's going to talk a little bit about our final feature, the challenge logger.
Excellent. So we've added a challenge logger to our survey as well. And the primary role for this is to provide feedback to engineers on where the infrastructure is lacking to serve these populations. And this is an opportunity for them to take a photo and document it, a video that demonstrates their experience, and most importantly, all of these are going to be linked to the GPS functionality associated with the phone and the app. So we basically give them a chance to take a photo or a video, identify what their problem was associated with that, upload it, we'll get the GPS coordinates, and then that will go into the overall database associated with the app. And now back to Noelle, I believe.
Or Courtney, do you want to talk about Travel Buddy, or would you like me to jump in?
Yeah, I'm sorry. Yeah, I can jump in. So the travel buddy is the final component, and this is just our way of further engaging people and getting, we think, hopefully, more rich data, qualitative data around the quantitative data on where they're going, what time they're going, and how far they're traveling. But we're also going to be engaging the participants through a series of text messages across the course of 2 weeks. And the text messages will elicit information across those specific domains of social exclusion. Again, resources like economic material resources, participation, so social activities, cultural activities, and civic and political engagement, and then quality of life, so health, safety, crime, etc. And we'll be sending questions to the participants about 2 to 3 times a week. But the goal is that we'll be getting some of those data in the real time in natural settings, and there'll be qualitative data that contextualize their transportation experiences and disadvantage. And now you can see again, here are sort of some of the sample questions for resources. Tell me about your day-to-day life. How do you get out of the house to meet your basic needs? So again, we're connecting transportation directly to social exclusion domains. For participation, how do you get out of your house to be politically or socially involved? Maybe they say they don't. Maybe they say they rely on a family friend or the bus. Quality of life, how safe do you feel leaving your house? Some people report that one of the reasons they don't like to take, for instance, Handytran is they just don't even feel comfortable with Handytran coming to their houses and in their neighborhoods, and them having to get in the transport, et cetera, because they don't trust their neighbors or whatever the case. But how do those domains really influence people's transportation behaviors and decisions? And now, since we're running to run time, we're trying to go a little bit quickly. I'm going to jump back to Noelle. She's going to talk to us about the just preliminary results of our app.
Yes, just real quickly, we'll talk. We did a beta test back in December, and we had a sample of 5 adults in the Dallas-Fort Worth area. Our real purpose in the beta test was to actually just try the app and see what kind of the quality of the data that we were able to collect. Was the training sufficient? And look at any other things that we needed to address for the full study that's going to be taking place with the older adults later this month. So user feedback surveys indicated that MyAmble provided the adults a new experience. Participants reported finding the face-to-face training helpful. We provided them a manual that provided screenshots and a lot of detail about the app as they could refer to that after the training. Users did report some challenges, including issues related to visual impairments, so things like the font size and color that we have subsequently changed, tactile barriers, so many reported the need for the use of a stylus. For instance, if someone had neuropathy or was diabetic, and so their finger sensitivity was a hindrance to using the keypad, they could use a stylus instead. We did provide Wi-Fi hotspots for our participants, and we found that sometimes the reach of the Wi-Fi, if for instance the participant was upstairs and the Wi-Fi hotspot was downstairs, then it wasn't going to communicate well with the tablet. And some difficulty with some of the notification features with the Travel Buddy text messaging feature, which some had to do with the Wi-Fi, and also some with just the settings on the actual tablet that we have since changed. But overall, users reported understanding what the questions were that we were asking most of the time. And as we are currently analyzing the beta test data further, we have begun finishing up refining the app, and like I mentioned, we'll be launching our full sample of older adults later this month. So on the next slide, Courtney will briefly talk about our strategies for success in this project.
Okay, so we really saw 3 domains across the project where we needed to focus our resources and our energies, and that was the software, the actual app, the hardware, the component on which the app was being used, and then the people who were using the app. So sort of looking at the intersection of the individual users with the app itself. First of all, as we talked about, Noelle mentioned, providing high quality training to the users was really critical. Some of these individuals had a lot of experience with software. Some of them had literally none. But we found they were all able to use the app fairly successfully, and we really credit that to the training. We developed a very high quality training manual. We provided training at the outset and then ongoing training, and we kept in touch with our participants. So they were able to talk to us in person as well as rely on the manual that we left for them at their homes when they had trouble. And again, engaging the users frequently. We didn't just give them the app and walk away for 2 weeks, except when we were collecting data points from them. We text messaged them and reminded them to use it at the beginning just to get them acclimated to the app. We texted them in the middle, how are things going? If we needed to make home visits, we made home visits. In terms of the software and the hardware, it's really kind of with the software, we found it was very critical to engage the software engineers from the outset of the project. So they actually really need to know what are the end questions so they can design the software backwards. So what is it that you want? And now we'll go ahead and try and design it. And having them be in on the planning processes and the storyboarding of the app from day one is very important so that at the end you actually get the product that you want. Even to the point where they need to know the research questions and how you want the data pulled out, because how they design the app is going to determine how the data come out. And you can't do anything with the data unless they're formatted in such a way that you can use them. So having the engineers know the research question really helped us in developing usable data for the app, resulting from the app. And then in the hardware, thinking about the size of the tab, we went into extensive search and compared products across all different types of hardware. Initially thinking about Apple because they're so robust, but eventually went with the Samsung Android because it was the most affordable as well as robust. Thinking about the size, we didn't want it to be too small, but you don't want it to be too large. So all of those components really take a lot of time and thought. And so now on this following slide, what we really found was that using the interdisciplinary team made this Venn diagram come together, so to speak. So we had civil engineers who don't tend, we say never, but let's be fair, they don't tend to think systematically about those who don't travel. And so this was a way to get them to think more from the end user's perspective of individuals who should be using bus systems included in transportation, but they're not. Social workers always wonder why city planners seem to systematically disadvantage certain groups, but we didn't know why. This is our chance to really learn about the transportation planning process, which allows us to advocate more effectively for these populations' needs and to sort of it's helping us to gather the data that the civil engineers need in order to make the public transportation planning decisions. And then finally, we have found that software engineers are really excited about helping address social issues, but they need projects to work on. They have lots of skills, but they're not necessarily wedded to a specific project. They just kind of want to, often, many times, improve the world. So this was a great opportunity to engage software engineers who are socially engaged and entrepreneurial in a way that leverage their resources and skills with our needs. And as we said before, we use Samsung tablets. And finally, what we did too, and I highly recommend this, is that we have exhaustively tested the app. We actually had an internal testing process with our graduate research assistants and ourselves. And then as Noelle reported earlier, we beta tested it with potential participants. So before it's even been launched, it's been through vigorous vetting by the research team. All right, and finally, I'm gonna let Noelle talk about this.
Just a few of the pragmatics, and Courtney mentioned a few of these. After a pretty exhaustive search, we found that Samsung tablets were great. We had to consider size, especially for the older adults, and weight. We had to make considerations for the size of the font, the colors, the buttons, and also, of course, the cost. As Courtney mentioned, we have tested and retested MyAmble before we're even launching the full study with older adults, which we have found has been very helpful in refining MyAmble. And in closing, I just wanted to turn it over to Steve to see if he would please just briefly talk about how some of the findings are going to inform recommendations related to transportation services and transportation planning for EJ populations.
So one of the things that we're working on in some additional follow-up research is trying to connect with NPOs and see how they currently consider transportation gaps in their transportation planning. And what we've found thus far is, by and large, they've identified populations that are suffering from transportation gaps, but there's no spatial or temporal component to the way that they assess gaps. This type of data collection could be one method that could be used to close those gaps and help us consider these transportation disadvantaged populations more proactively and more clearly in our plans, and ideally turn EJ analysis into not just do no harm, but to improve the conditions upon which we have provided, and really try to support these populations in their need to access critical activities for human existence. And that, I believe, wraps us up for questions.
Great. Thank you so much, Noelle, Courtney, and Stephen. A great webinar, and we do have time for a couple questions. For those still viewing, you can still feel free to submit your questions if you have them. Like I mentioned earlier, we will respond to questions that do go unanswered after the webinar. So first question goes back to the app usage and for the respondents, and there's concern for the length of the survey and the amount of time. So do you have any data on the average amount of time it takes, and do you think it could be cumbersome or maybe a barrier to getting your survey results?
I can answer that part. Go ahead, Steve.
I think we're looking at essentially the same kind of scenario that we'd be looking at in any kind of travel diary, where you're documenting the types of trips that you're taking. This is a little bit more unique as a research project right now to try to document the consequences associated with the gaps. That may not be something that needs to be present as we move forward into moving this kind of data collection into practice. But I think it's critical for right now to get a better sense of the importance of travel to these particular populations.
Great.
This is Courtney. I just also wanted to mention that the app they're using it across the course of a day. So it's designed to sort of just become something that they casually refer to, maybe once or twice a day. They don't sit down and go through the laborious process for, half an hour every single day. And what we found is the participants, once they had used it for like a day or two, the morning and evening journals became very quick to use, because we've designed it to be something that they can quickly become habituated to. Oh, okay, I just answer this, yada, yada. And we've also built in like sliding scales, so they don't have to sit there and select a specific item. They can just kind of quickly slide and say, oh, this trip was important. Oh, it wasn't important. So we've tried to build in technical components to the app, as well as through the formatting of it, that makes it something that they can quickly become habituated to and then use with a great amount of ease.
Okay, great. Another question about the app, the software app. There's concern that some of the trips may be missed due to the complexity of the entries. Courtney, you did discuss that a little bit, but this is more in response to Stephen. You had mentioned the IRB issues. Have you guys considered making the app a multimodal travel planner to help plan a trip and then use the GPS to determine if the trip was made along with the origins and destinations?
We do have GPS that's pinging periodically to verify the tablet location. So we are trying to correlate back to their planned trips. We're just not trying to track them at all times. There could be potential to merge our app with something more sophisticated in the future, once again, as we're starting to move towards practice and application.
Okay, great. And it looks like we have time for one more webinar or one more question. And this could be open up to all three presenters, and it's more of a future steps, next steps. Do you plan to publish the results, and what kind of research, or what are the next steps, I guess, for the software?
Yeah, hi, this is Noelle. Yes, we'll definitely be publishing. We'll be able to look at publishing data off of the older adults, see the respondents for that, and then of course we'll have our sample from mothers. So we will be publishing that and presenting it at state and national conferences. The goal, I believe, is to eventually be able to have MyAmble used more in practice, and so we'll be able to, some features of MyAmble can be, sort of minimized and not utilized for certain settings or with certain populations, but our hope is that this will become a tool that communities can use in different ways to assess, evaluate, and plan for EJ populations in terms of transportation.
Great. Courtney or Stephen, do you have anything additional to add?
I do not, thank you.
No, I think that's sufficient right now.
Great. Well, thank you, Noelle, Courtney, and Stephen again. It was a great webinar. This concludes the webinar for today. Thank you for joining us. You can view other professional development offerings on our website at nitc.trek.pdx.edu. Thank you, everyone. Have a great day.
Thank you.
Thank you.